Welcome to Ways to Wellness, the show that gives you medical advice from a TCM perspective and a Western medical perspective. I'm your host, Stephen Weathers. All of us have ailments every week, whether it's neck aches, back aches, stomach aches, pain in the arm, or tingling in the fingers. But did you ever realize this could be coming from something more serious, like herniated discs in the spine? So today we have two doctors to discuss this topic, a Chinese medical expert, Dr. Jen, and also Western medical doctor, Dr. Li.
Dr. Zhong Li graduated from Life University and has been practicing at the medical and physical therapy clinics all over the United States ever since. He's currently practicing at the Shanghai East International Medical Center as part of the physical therapy and chiropractic team. Dr. Zhang Hongshen is Chief Physician of Department of Orthopedics and Traumatology of Shanghai Shuguang Hospital. He's also Vice President of Subhealth Branch of Chinese Medical Association. Just take a look around and you will surely see a slew of bad hats buried in their smartphone whenever they are taking an elevator, walking, or eating. This is a phenomenon known as phubbing, or ignoring other people in favor of your phone. In addition to hurting your relations, phubbing may also hurt your neck. Staring at your phone can cause a loss of neck curve or even a reversal of neck curve.
那这个病有什么危害？
颈椎病当中最严重的有一种情况就是会影响走路，这个人有可能会瘫痪。当然，这个概率比较低，一般在颈椎病的这个所有的颈椎病人当中，大概是占到3%左右。
That sounds really serious, and it reminds me of one of our audience members who contacted us through WeChat. Her back and neck pains are so severe that she sought help from us, and we have given her some treatment. Let's take a look at her story.
Ming Yuexin, a 56-year-old working in finance, has suffered from neck pain for more than 30 years.
看一直来看，但是没介结棍。就从去年子开始，我越来越结棍。
Occasionally, her neck pain flares up, greatly impacting her daily life and work. Although she has turned to many doctors for help, her neck pain still persists.
我有个烧饭烧了蛮好，对伐？头一时间，那么一记头就人要倒过去呀，倒呢就往里向倒，随后人开始兜地翻了，人就往下头折，折了后越差。 那我就拿搿只么脑子清醒哦，我就拿搿只物事一拉，搿只好吃来吃得了。最后只头呢就拼命个拿搿只头发拉紧，拉紧。大约我侬30分钟辰光对伐，就慢慢地缓解了。缓解了，侬做过一种7、8分钟辰光，呢就立了得跑动哦。那啥人也冇碰我，越碰越结棍。
Wang Ling is a 24-year-old ballet teacher. She used to be an on-camera correspondent at the Jiaxing TV station. Despite loving the job, Wang Ling was forced to quit due to neck pain. As a young dancer, Wang Ling hurt her neck while training. Since then, chronic neck pain has haunted her.
以前学舞蹈嘛，然后上课的时候练功，然后就在下旋上起不来了。后来就是到医院去整好，但是就觉得一直都很难受。从去年开始的时候就会有头疼，但之前都没有。那先是这边疼，然后现在最近就是这边右边，也不是说疼特别厉害，但是就是轻微的、略略的那种一点疼。
Dr. Jen， 这个病有什么治疗？
我们从4个方面来考虑。第一个方面呢，就是它局部有问题，有伤筋动骨、经络不通，所以呢，我们可以用手法把这个筋给它理顺。 把这个骨头卡住的地方呢，用整骨的手法把它对回去。这个关节要严丝合缝，对好了，它就正常可以活动了。那么经络不通呢，我们也可以扎针灸。这个局部治疗完之后呢，如果这个病人整体上面有一些这个体质比较差呀，身体比较弱呀，全身的情况不好，而且呢时间比较长的这样的病人，我们可以用中药，或者用一些既是食物又是药物的这种药品。 食品吃进去，从里面给它调节，全身来起作用。那这个2部分呢，基本上是在医院里面由医生来帮助他的。但是颈椎病这样的一个病呢，其实它有一个特点，它回到一个正常的生活工作环境当中啊，经常又会复发。那所以呢，我们还会告诉病人，让病人呢配合，从2个方面来注意。一个方面呢，就是尽量的能够养成一种好的生活习惯。 啊，比如说坐的时候尽量人坐直啊，不要长时间的低头啊，不要受冷啊等等，这个是一个良好的习惯养成之后就可以预防。那么第2个方面呢，就是会教他一些锻炼，专门针对颈椎 提高这个筋的保护能力，做一些颈椎的保健操。
Okay, Dr. Lee, he's just explained to us there's a four-step method in treatment. What about from a Western medical perspective? What is the treatment there?
The one I'm going to focus on is mostly the mechanical part for traction, or decompression as we call it. Let's talk about what's happening with the herniated disc. Let's pretend I have a balloon. Okay, I'm pushing down on the balloon. The balloon is representing the disc. As I push down on the balloon, the edges come out and bulge. When I lift my fist off the balloon, what happens? Edges go back in. Decompression works on the same theory. What's going on is I'm trying to take pressure off the spine and the disc. So what we do is we actually strap a patient into the machine and we gently pull and traction the vertebrae apart. Okay? What's going on is we're creating a negative pressure. The negative pressure is actually pulling the herniated material back into the disc. And what happens then? As I take the bulge down, as I bring the material back in, the pressure is no longer on the nerve. You get decreased pain and decreased symptoms.
And what are other treatments then? That's one you talked about, but...
Other treatments. Okay. A big thing we like to do is non-invasive, invasive. We're talking about non-invasive today. So non-invasive, we do a lot of myofascial therapy. Okay, there's different techniques all over the country about active release technique, massage. But the massage you're doing is very specific. For example, let's talk about cervical pain or neck pain. What's happening is a lot of times when your neck is in this position, all the muscles are seized up and spasmed. So what we do is pretty much have the patient lie down on their back, and we work on each individual muscle in the neck slowly, working it along the normal range of motion. The goal is really to get the motion back to normal, which is the most important thing in recovering from any type of disc herniation or any type of injury.
Both Ming Yuexing and Wang Ling have exhausted the options offered by Western medicine, so they've chosen to give traditional Chinese medicine a try. Dr. Zhang used X-rays to confirm the degree of deformation in the neck curvatures.
一般这个颈椎有7节嘛，是第2颈椎，再下来第3、第4、第5、第6、第7，颈椎一共7节。正常的话呢，它应该是一个弧形。那么第4颈椎，像这个颈椎应该在这个位置最前面的。所以等一会儿呢，给你说一个办法，就是把这个弧度要给它垫出来，让这个骨头再往前回到正常位置。
First, we need to completely relax the muscles using traditional Chinese tui na. Then we can push the deformed neck back to its original shape using osteopathy. Fortunately, Dr. Zhang told us our 2 patients have the potential to rid themselves of neck pain once and for all after 3 months of treatment. Ming Yuexing and Wang Ling are thrilled to hear this. However, tui na and osteopathy treatments alone are not enough. Our patients will still need to do daily exercises in addition to these traditional Chinese medicine sessions.
你觉得这个痛需要每个月或者每个2个星期有推拿或者还是一个 massage？
如果是他有这个骨错缝的情况，我们要矫正的话呢，一般我们不主张呢，就是矫正的太多。因为多了之后，这个关节会松弛，反而更容易出现一些移位，所以一般像我的个人的临床经验呢，每个星期做1次，有的时候隔1个星期或者2个星期再重复个2、3次，基本上它就稳定了。
这个病有什么预防？
一些诱因我们尽可能的要减少或者避免，比如说刚才说的一个受力太多，长时间低头啊，一个动作一直不动，是吧？第2个呢？就是受冷，这个受冷呢，包括局部的受冷，比如说空调啊什么的。还有一个中医认为这个冷啊，这个寒呢，会从体内产生。比如说你经常吃这些冷饮、冰冻的东西，或者呢，现在一生病到医院都去输液，尤其冬天，这个很冷的液体输进去，等于直接到寒气到血管里去了。那么反复频繁的接受这样的治疗，也是一个诱因。那么第3个还有一个，我们每天都要睡觉。睡觉就要垫枕头，所以现在的枕头问题很大，我们特别要注意，尤其是颈椎已经开始不太好的人，这个枕头呢应该要区分正常睡觉的枕头和辅助治疗用的枕头2种，一定要用对。我们现在看到的很多枕头有一个弧度，有一个形状，而且比较硬的这样的枕头，通常呢它是作为一个辅助治疗用具，不能够睡觉用。有一些朋友不知道，拿了这个枕头睡觉，结果把颈椎病睡出来了。所以睡觉的枕头应该是比较柔软有弹性，然后这个高度呢和我们自己的肩宽差不多高，这个比较合适。那么另外的那一类治疗用的枕头呢，可以每天这样躺在上面睡， 把这个弧度垫起来，颈椎这个地方有一个弯度的，把这个弧度垫起来之后呢，只要睡上半个小时左右就够了。
Well, I think a lot of audience members are watching now. Maybe they're at home sitting on the couch, maybe their posture's not too good, or maybe they're on the metro watching on their mobile device. So let's give some practical tips to our audience. How can we encourage them to prevent the neck and back pain? Are there some exercises you can show us now?
When you're sitting on a chair, there's a natural curvature of the spine. Okay? So a big thing people need to know is if they're at the office, when they lean against the chair, roll up a towel, put it in your lower back. You should almost have a little gap between the chair and your back.
To arch your back?
Yes.
Okay.
There's actually a certain type of exercise for herniated disc. What we're looking is really trying to stabilize the abdominal area. Here's what we've learned over time. I can just do it like this. Over time, people are learning to take deep breaths, right? When you take a deep breath, what you're doing is you're contracting your abdominal muscles. There's a better way to do that. What you gotta learn to do is actually contract your abdominal muscles and breathe normally. These are simple spinal stabilization exercises. So what I would do is I would contract my abdominal muscles, and while my abdominal muscles are contracted, I would try to breathe normally, okay? And that feeling you have in your stomach, that's what you want. You want that stabilization in the spine.
One final question to the both of you. We're all addicted to our smartphones these days. So what's the best way to look at our phones?
Let's go back to modifying activity. What I do, I look at my phone all the time too. All my games are on there. There's new games, Flappy Bird, all these games. What I like to do is actually hold my phone up. Okay, what I'm trying to do is decrease the pressure in my spine from leaning forward. So pretty much, I'm holding it up. So
Just hold it in front of your face.
Unfortunately, you have to look at other people around you, but it doesn't matter because everyone's head is down anyway.
Right, they won't see.
So I would modify that.
Yeah. 那你呢？有什么锻炼可以告诉我们的观众？
锻炼方法呢，就是最简单的就是伸懒腰。
伸懒腰。
伸懒腰，我们在累的时候会。
So stretch, just stretching straight.
对。这个用力向上撑，然后这个两边呢尽量贴着耳朵。
OK。
然后这样，到了这个极限位置之后呢，可以这样动一动。
Right. Burn.
过不去的时候要停一停，然后往这边转。
OK. So it's aligning the spine.
对，也可以往后、往前。那你如果是人站在这个地方做的话，还可以弯腰。那么这整个的脊柱后面都可以得到拉伸。那如果再加强一下的话呢，可以再做2个动作。一个呢，我们是叫运肩拔背、松筋脉，就是以这个肩关节为中心画一个圆圈啊。比如说坐在这里，提起来，然后向后拉，向下放松，对，画圆圈。这个叫运肩拔背，也可以反过来做，向后拉，向上提，向前啊。那么这个提起来的时候呢，头尽量往下用力，通过这个动作之后，把这个筋呢牵拉，它就放松了。本来很紧，本来很紧，现在放松了。
Putting the discs back in the shape, the right shape.
那么这是第一个动作，一个方向做10圈，反方向再做10圈，一共20圈。做完之后，这个周围的筋都放松了以后呢，再开始活动颈椎。活动颈椎呢，一共有6个方向，分开来活动啊。一个呢，先往前低，低到最大的这个角度以后停3秒钟，啊，1、2、3，然后呢，慢慢的往后仰，啊，停3秒钟，1、2、3，再回正，啊，前后，然后左右，1、2、3，再向后向右，回正，这样前后左右，对，然后再左转。
Do you need to put your hand on your shoulder? 需要放手。
这里要放松，对。
Okay, just relax.
对，这样转头，啊，然后再慢慢的向右。
Now let's have a review of the tips from the Chinese and Western medicine doctors. Our Western medicine doctor suggests massage and traction to treat neck pain, while the traditional Chinese medicine doctor offers tuina, osteopathy, and daily exercises as a solution. Both the Western and Chinese doctor also noted that surgery would be an option if these other methods didn't have any effect. For more health information, please do join our WeChat. We will offer you some tips almost every day. You can search for our official account, ICS 养生东西方, or our ID, Ways to Wellness, or you may scan the 2-dimensional barcode